Joining me now for our live coronavirus special tonight is Dr. Navarra Rodriguez. She's the president and chief medical officer at Advantage Care Physicians. She specializes in internal medicine. So we want to thank you for being here tonight, Dr. Rodriguez.
Good evening, Scott, and thank you for having me, and thank you for being able to talk about health impacts for our communities.
So with that in mind, maybe you can just give us sort of a thumbnail sketch of what you're seeing in your practice right now.
Absolutely. Advantage Care Physicians is one of the largest primary and specialty care practices in the New York metro area. We have 38 offices in the 5 boroughs of New York City and out onto Long Island. And we're really focused and have been on team-based care and caring for the whole you, thinking comprehensively about our patients, both their physical conditions, mental conditions, and social conditions to see what we can do to keep them healthy. In our practice, we have seen the devastating effects of COVID-19 from those who have been acutely ill, those who have needed hospitalizations, but those relatives and other folks who have lost loved ones to the virus. We also see patients who have not been critically ill, but have had to self-isolate and really restrict their interactions. So we've seen the whole gamut from soup to nuts with regards to COVID patient care at Advantage Care Physicians.
So with that in mind, let's talk about some of the treatments that, we're just now starting to get some results back on. It looks like chloroquine is a non-starter. It has caused some deaths, and a recent study found that you're actually more likely to die from a heart problem than it was for you to be treated successfully by that. On the other hand, there's this antiviral drug remdesivir. A recent study showed it reduced time in the ICU by a few days for some, but not all patients. So why is this something that a lot of doctors really are celebrating? It seems on the surface like it's not that big of a deal.
Well, anything that could help us impact the impact of this virus is a big deal. And I know the scientific and medical community is looking for many different ways of combating COVID-19. Remdesivir looks very promising in reducing the length of time that patients have the virus. So reducing the number of days from 15 to 11 days of being acutely ill does have an impact such that we can reduce the risks of patients being in the ICU for extended periods of time and reduce the ravages of the virus overall. Though there haven't been significant impacts on morbidity and mortality that we've seen so far, it's early days, and a lot more studies and understanding about remdesivir and other treatments will be important in the days and months to come.
Is that when you talk about how, the more we know about this, maybe the better it will, the more we'll know about how it responds to this coronavirus? Is that something that could then we use down the road to help open up? So a lot of people now getting frustrated being home, concerned about their job. This might be a tool that will allow us to perhaps open up our economy a little bit more.
Well, it's important. At Advantage Care Physicians, we think knowledge is power, and knowledge about one's health conditions is important. So as we learn more about the virus and how to manage the virus, I think it's important for us to share with our patients and our communities so people feel empowered and can seek care, not only for COVID-19, but to not feel afraid to seek necessary care for things like diabetes, hypertension, asthma, and all of those chronic conditions that didn't disappear just because COVID-19 came to the surface. So the more we know and the more we can share, the more we study this virus and its impacts, the more empowered we will be to solve this and get back to a relatively new normal of interaction.
So you were saying, you're an internist, you deal with a lot of patients, I would imagine, that have those chronic type of diseases, hypertension, diabetes. Are you able to see those patients in the numbers or in the way that you would hope? Are you concerned about how, under the current restrictions that, patients can't come in to see you like they would under normal circumstances?
Obviously, social distancing and the restrictions are very important as we've been able to flatten the curve and have impact on our communities. But Advantage Care Physicians has remained open during this whole time and over the several weeks for urgent care needs. And we quickly implemented virtual visits and telephonic check-ins for our patient base. So we weren't ignoring patients who needed to follow their diabetes or follow their blood pressure or needed prescriptions. We facilitated home delivery of pharmacy services. So we've been accessible to our patient base throughout this pandemic and even during this time of social isolation.
Now, one of the more troubling aspects of this virus is the fact that the vast majority of adults under 60 have few, if any, symptoms. Very few, though, do end up in the ICU, and some die. We had a story just a couple weeks ago of a guy who ran a personal training business, in 30 years old, in perfect health. He died. We are starting to learn more about blood clots and that the problem this disease creates with blood clots, perhaps blood thinners being an answer. What can you tell us about that?
This virus is devastating, and it is a killer. We know that there are many people who carry the virus and are asymptomatic, and there are those who develop very severe symptoms and need to be hospitalized in the ICU and intubated. We're seeing emergence of risks, cardiovascular risks like blood clots and strokes and other things. And as a medical community, we will be learning more about how COVID-19 impacts the body and what we need to do to help treat patients more effectively and efficiently. But it is a scary time and a scary disease.
I want to go to a question on Facebook that I just got a minute ago. Mary asks, I have a question. Is it safe to use your air conditioning? I live on the 5th floor. I'm assuming that she's referring to her concern perhaps with being in a room where the air continues to circulate.
Yes, it's fine to use your air conditioner, and having good circulation of air is important. We want that to make sure that we can keep the air fresh for everyone. But in terms of being careful in one's home, making sure you're disinfecting surfaces, not touching surfaces and then your face, making sure you're disinfecting high-touch items like your remote, your phone, etc., is important. And always when you have to go out to the grocery store, the pharmacy, or for those essential things, making sure you're really following good hand hygiene, washing your hands frequently to make sure that you're not carrying any germs.
And with that in mind, should people be wearing a mask when they're running outside, bicycling outside? I take my dog for a walk. There's basically no one around, so I don't wear a mask if I'm just walking down my street. I certainly do if I'm in the grocery store. Should I be wearing a mask no matter what if I'm outside?
I think you should be wearing a mask if you think you're going to be interacting with other individuals or people. It's hard to say because, again, different neighborhoods, different areas, different cities and towns have different densities. You definitely want to have a mask if you're going to any place that has a congregation of people. So going to the store, going outside where there will be multiple individuals present, you should wear a mask.
And what would you tell parents about this Kawasaki disease-like syndrome that is just now starting to pop up in children? Doctors believe it might be related to COVID. The county executive is going to have something on that tomorrow. This is sort of a new thing that just seems to have come out in just the last few days.
Though I'm not a pediatrician, as I talk to the pediatricians within my practice, Advantage Care Physicians, we know that we're learning more and more about COVID-19 as days go by, and the concern about Kawasaki disease, an inflammatory condition in children with fevers and rashes and skin changes, is something that has emerged as something that we believe is affiliated with the virus. I would urge parents, if they have questions, to connect with their pediatricians to talk about their concerns with regards to their children and how to protect them.
All right, so here we are we are now a couple of months into this whole thing. What have you learned about this virus, perhaps, in maybe the last couple of weeks that you didn't know of when this thing started?
Oh, there are many, many things that I've learned over the past couple of months. Yeah. The top three, that, there are certain patients, especially African American and Latino populations, that have been severely hit with the virus, and that has been of concern. The fact that this is a very insidious virus in which patients may not have symptoms but be infectious has been concerning. And I think one of the things that has emerged over the past day, as New York State Department of Health has done more studies around the virus and hospitalizations, learning that many of the patients who've been hospitalized in the past 3 days have seemed to have been doing the right things. They've been self-isolating in their homes, yet still contracting the virus. And so, I think this raises concerns and really should heighten our awareness of being as strict as possible in our own self-hygiene regimens, washing hands frequently, as I said before, disinfecting frequently as much as you can, wearing a mask in public, and to make sure that you're minimizing exposure to numbers of people as much as possible.
All right, Dr. Navarro Rodriguez, I tell you what, let's continue this conversation on the other side of the break. We'll be right back. One thing we haven't talked about, but I do tend to talk to, especially the people who, the managers of these types of organizations who see the broader perspective, is how are you guys doing on testing? There's been a lot of talk that we need to double our testing. Are you able to give tests to the number of people you would like to give them, or are you still having to sort of pick and choose?
We ramped up testing as we had availability for protective equipment over the past several weeks. I'm pleased to say that we have testing to test for the molecular assay. So folks with active symptoms in 11 of our offices, soon to be 12 by next week. And we are very excited about the opportunity to think about how antibody testing can help us understand the COVID-19 virus and understand its impact on our communities. Our testing has been predominantly focused on healthcare workers, frontline workers, essential workers, and patients who are vulnerable due to chronic conditions and comorbid conditions. But I'm very glad to say that Advantage Care Physicians has been able to expand our opportunity to test patients in the past several weeks, and we look forward to even more expansion in the weeks ahead. We do this testing by screening first via our virtual visit capacity, and then making sure we're sending patients to get the right type of test and have our patients understand the impact of those results and what to do afterwards. But it's a great opportunity for us to be able to test more patients in the communities and understand how we can prevent transmission.
But someone, let's say someone like me, like I've been the one that's been, I've been coming to work, but I'm in an empty building. I've been going to the grocery store, but the rest of my family's at home. They really haven't left other than in our car. We just drive to get out of the neighborhood for a few minutes. Would I be able to go in, and I haven't had any symptoms of any kind, would I be able to come in and say, you know what, because I'm curious to know if I've already had it and just was one of those lucky people who didn't show any symptoms, or perhaps I've just been very lucky and I haven't been exposed to it yet?
Over the past several weeks, we do know that there have been limitations to testing, both the molecular assay and antibody testing. And I think every region, every town, every geography, and every practice may have different availability of these tests. But I will say over the past week, there has been an expansion of the number of tests performed by New York State, by the different counties, by New York City, and by independent practices like Advantage Care Physicians, as well as hospitals, to increase the access for patients to be tested and understand their symptom profile and their risks.
So a lot of procedures have had to be on hold now for a couple of months, and those were deemed to be not, to be, I guess, what's the word that they use?
Not essential or not critical.
I mean, but what people would describe as not essential, I mean, we're talking about cancer treatments, some other things that have had to been put on hold. We're not talking about facelifts here. When do you expect that you could be giving some treatments to people that they have been needing and just have had to hold off on it?
Well, for practices like ours at Advantage Care Physicians, we've been treating patients for chemotherapy and other therapies as we've deemed appropriate and as patients have needed. But while New York State has been on pause, and while our hospital system and under heavy duty with the surge of COVID patients, those non-critical, non-essential, or elective surgeries had been postponed. I anticipate in the coming weeks, as New York State comes off pause regionally, those elective surgeries will begin to ramp up again, but with priority for patients who need a cancer diagnosis or a breast biopsy to diagnose breast cancer, or colon cancer treatments, or cardiac surgery. So I expect within the coming weeks, as our hospital systems get beyond the COVID surge, that those access to procedures will also open up.
How long do you think it would take for you guys to get to something closer to normal, knowing that there's this huge backlog right now?
That's a great question, and I have to admit, I don't know what's normal anymore. I think we're going to evolve to a new normal. But what I do say for my practice and providers and staff, as well as other hospital providers and staff across the region and across the state, we want to make sure that patients get the right care at the right time and are led on a path to better health. And so anything that we can do to support our communities to be healthy and stay healthy, either virtually or through surgeries or treatments, we want to do that.
We only got about 30 seconds left. Have you had to have any of your employees or have any of them been diagnosed with coronavirus?
Unfortunately, like many healthcare providers, we've had employees and staff who have had the virus, some who have succumbed and passed away due to the virus. So we understand the devastating effects of this virus and the importance of knowledge and taking care of each other.
And welcome back to our special on the coronavirus. I am joined by Dr. Navarra Rodriguez, an internist. We want to thank you again one more time for joining us. Dr. Rodriguez, you mentioned earlier about how this disease in particular has really hit the minority community, in particular blacks and Hispanics. You said that your practice itself has lost some people. Do you see anything that points to a reason why it has been so hard hit in those communities?
There are many theories, Scott, about why these hard hit based upon density of populations, risk factors for these populations like diabetes, hypertension, obesity, congestive heart failure that we know have correlations. But there's still a lot for us to learn why these populations have been hardest hit during this epidemic in this region. So we will learn more, but it really pushes us to be hyper aware as communities as to the risk of this virus and being on top of ways to learn more and to protect ourselves.
We only got about 30 seconds left. I just want to ask you, do you see anything in the data that's giving you hope today? Something we can try to end on a hopeful note?
Well, let me end not so much on the data. I do see the trend in the curve coming down, but I want to just call out the fact that it is Nurses Week, and I want to celebrate all nurses out there and all healthcare workers, as you did at the beginning. But Sunday is Mother's Day as well. So to all the nurses out there, all the mothers out there, thank you for keeping our families, our communities safe, healthy and well.